KupunaWiki radio show. This week we have a special show where we'll be discussing the new coronavirus. And in studio we have Dr. Lee Buenconsejo Lum, a family medicine specialist and associate dean with the John A. Burns School of Medicine. And we're going to be having a conversation with her as an expert in the field, and she's going to give us some insights onto this new coronavirus and what we can do as a community to help each other. KupunaWiki is Hawaii's senior resource. We talk to the best local professionals in the state regarding topics such as real estate, senior housing, estate planning, finance, and health, so that our Kupuna families can find the best resources in the midst of a life transition. We strive to make sure our seniors are informed and supported every step of the way. Thanks for joining us today. I'm Brandon Lau.
And I'm Andrew Leon,
your host for the KupunaWiki radio show.
Our title sponsor for today is Cheney Brooks Choice Advisors, providing you with the best real estate information so you can make the most informed decisions. As they like to say, real estate is about choice. To contact them, call 753-9033.
And now we have our real estate tip of the week, brought to you by Cheney Brooks Choice Advisors.
According to the 2017-2018 National Pet Owner Survey conducted by the American Pet Products Association, 68% of U.S. households own a pet. This includes over 60 million dogs and 47 million cats. When purchasing or selling a home, homeowners are encouraged to chip their pets in advance of moving. Moreover, updating your contact information for your pet's chip is critical too.
For more information on how to care for your pets and your properties, contact Cheney Brooks Choice Advisors at 753-9033. Well, again, in the studio, we have the honor of having Dr. Lee Buenconsejo Lum, a family medicine specialist and associate dean with the John A. Burns School of Medicine. Welcome, Dr. Buenconsejo Lum.
Thank you for having me.
Thanks for being on our show. Well, maybe you can share with us perhaps a little bit about your current role and how you became involved in the medical profession.
Okay, sure. So I always wanted to be a doctor since I was a little kid. Definitely knew it from the time I was 12, and kind of really focused my path that way.
Right.
I went to Liverpool High School in Waihoa,
All right.
and then went to Stanford for college and was the kind of typical pre-med, and was fortunate enough to come home to medical school here. And then when I was in, why I wanted to do medicine was because I love science and I love helping people, and I come from a family of educators, and so what better way to meld that and help teach patients and teach others. And many people think that their doctors are going to be in practice and open up and everything, but I chose academic medicine because I felt that I could make a greater impact on the entire community by actually training more physicians of all specialties, but especially training more family physicians who would be really, skilled and able to care for the whole family, really kind of embracing where they're at, what their culture is, and how that really, what their life situation is, to help, really guide them through that.
That's wonderful. But you also were practicing back in your hospital at Waihoa General, right? You mentioned?
That's correct,
So
right.
where you were born,
I was
back to the roots?
I was born at Waihoa General Hospital, and then in 1994, when I started my residency, that was our training site, and so it was such a great honor to be there, and to be back home.
Right.
My great uncle was a physician there, and
No
so
kidding.
lots of roots in Waihoa. And in fact, one of the nurses had retired, and she ran the gift shop, and she was my mom's labor and delivery nurse.
No kidding.
So she's like,
Wow.
"Hi,
Yeah.
you were born, literally."
Literally.
And look how you turned out. She did a great job. Well, we know you're also very engaged right now in the current educational aspect of helping the community understand this new coronavirus. Share with us, what have you done so far?
Sure. So I wear multiple roles at the medical school. My main role now is that I oversee all of the educational programs that will help train physicians. So this includes pipeline programs with our high schools and others to try to encourage students to enter health professions in medicine. And then I oversee we have a post-baccalaureate program, our medical education program, all of our residency and fellowships, as well as our faculty. So I kind of oversee all of those things. And then I also directly oversee the residents and fellows. But because of that, and because of my role in working closely with the hospitals and Department of Health and many health partners, it was very natural for me to get involved in this. you know, it's the hospitals and the clinics are our main training sites for our students, and so we thought that, you know, it'd be really important for the medical school to help really get involved in this effort. So yeah, I've been a part of several, you know, many different layers of planning meetings and constant communication with the hospitals and our department chairs and others. And then, you know, of course with the larger UH as well, trying to do a lot of different things to help the community get through this.
Well, I must, you know, tip my hats off to the medical professionals out there who are actually on the front lines of this battle right now. And it really is a battle against this unseen opponent. And, you know, I just applaud them for being willing to stay out there, you know, and it's a big sacrifice. In fact, I know doctors who are self-quarantining themselves from the rest of the family for the sake of being able to serve others in the community. So that's really, yeah, that's really honorable.
Yeah. It's definitely true, you know, where possible, many of us are trying to move towards telemedicine or at least telephone visits, because we know that a lot of our patients may actually not have good access to the internet, they may not have smartphones, but almost everybody has a phone. And but there definitely are people that need to be seen, and so yeah, many of our frontline providers in primary care, especially in the offices as well as in the community health centers, are working really, really hard. You know, there's a lot of fear and anxiety out there, and doing their best to just really reassure the patients, but also make sure that they're still getting really good care. You know, so even if we're asking you to postpone your visit or reschedule your visit, we still want to stay on top of you and make sure that eventually you do get your mammogram, you know, or you do get your blood test, but maybe not right now.
And it is so difficult to prioritize, right? Because I think in everybody's mind, their issues are probably paramount, but there's so much else to take care of, right? So maybe you can share a little bit from the health community's perspective. I know there's concerns just about the lack of equipment to protect the practitioners and so forth, but how are they feeling right now?
Yeah, I would say nervous. You know, the frontline providers are because of the lack of protective, so PPE, as you've seen in the news, or personal protective equipment. You know, there is a lot of nervousness. You know, and so yeah, like you said, many of our faculty physicians and physicians in the community, they don't want to bring it home, you know, but yet they know they have this duty to serve, and so they're doing what they can. You know, the priority for masks and gowns and gloves, of course, you know, go to the hospitals because it's really clearly important, right? The sickest people go there, but so many patients are out there just asking questions, and you know, we're just really not certain yet about how extensive this virus is within our community, you know, and so I think that's really contributing to some of the anxiety. But you know, folks are still there and using their masks and gloves and doing their best to practice social distancing, even with the patients, you know, and trying to, you know, really stay 6 feet apart until the time that we really do need to examine the patient.
Right. If there's something that the community can do to help, in their role to be responsible for certain things, aside from social distancing and, you know, having good hygiene, but also with respect to the medical community and how they're trying to help, what would you ask the community and the public to do?
Yeah, that's a good question. I think, you know, one of the things, now there aren't a lot of masks to purchase in the stores anymore, but you know, early on, 2 weeks ago, right, there was a big run on everybody getting masks, in addition to toilet paper. But we really, you know, I think do ask folks to not, you know, to really help reserve those masks and gloves and other things for the health professionals. It's really hard. People are having the health providers are having a really hard time finding these supplies. You know, we're having to go to Home Depot or Gas Pro or, you know, all these things. Our hospitals just put out a call for supplies and asking, you know, folks in the construction industry or painters or others who may not be using their entire stash to, you know, help donate. At least until we can get the whole movement of supplies from the national stockpile into the Hawaii stockpile and mobilized, and you know, some recent federal legislation have helped to reduce barriers to
Right.
getting not only new supplies imported, but things made more
Mhm.
quickly here.
Mhm.
And so hopefully within the next couple of weeks, that situation will be better.
Oh, that's good.
But, you know, that's a couple weeks, right? That's a lot of
Right.
patients that we see.
And we have a long road ahead.
We do,
Yeah.
you know, and we don't know. But
Right.
hopefully, you know, the testing results we see are, you know, coming back. We've got
Mhm.
5 more today. You know, we're expecting to see, you know, a few more, or hopefully not more than a few, but, you know, we just don't know.
Right.
And, but, you know, the test results are starting to come back. You know, our
Mm.
commercial labs did start testing here, you know, over a week ago, and we do know that it takes about 4 to 5 days, sometimes up to 7 now, though, but
Right.
because just the demand for testing.
Mhm.
But at least we're getting testing done. We now have testing sites on all of the neighbor islands, which
Right.
is fantastic.
Right.
You know, folks on the neighbor islands, or even more, you know, here on Oahu, we're lucky. We had
Mhm.
42 places that you could test, and, you know, some of our neighbor islands didn't have testing until this week.
Yeah, that's
So,
it's a
you know,
challenge.
it's a real challenge.
Mm. Well, for the testing that has been done, obviously, I think there's steps the community or somebody who's concerned about their own health can take before they go in and get a test, right? They want to make sure that it's warranted. So what would you recommend in that case?
Yeah, that's a great question. So, the big thing to know is that the tests are going to be most reliable if you're actually having symptoms.
Mm.
Right? So the first thing is to determine your risk.
Right.
Now, the CDC.gov, which is the Centers for Disease Control, if you do have access to the internet and you Google CDC.gov symptom checker,
Mhm.
they do have an online thing that you can use on your phone, and you can
Right.
click to see actually if you are at risk.
Mhm.
And so that's really the first thing, you know, is have you traveled recently in the last 14 days?
Right.
You know, have you come into contact with somebody who's actually known positive?
Right.
You know, I think a lot of the uncertainty is because we travel all over the place and we just don't know who's positive, right?
That's right.
I think there's a lot of confusion about what is actually close contact.
Mhm.
You know, us sitting here in this room, we're socially distanced, but
Yep.
it's in a room.
We're 6
so,
feet, I would say.
You know, but we're
Give
more
or
than,
take.
we are, but we're more than 15 minutes, right? But all of us are healthy. We're not coughing. We're not sneezing.
Right.
You know, but if you're in a kind of enclosed space, if you're, you know, more than 15 minutes with
Mm.
someone, and especially if they're symptomatic, meaning the fever and the cough and the sneeze, then okay,
Yeah,
you might be
right.
at some higher risk. If you yourself also have fever and some type of respiratory symptom. The other thing, though, that goes into determining risk is your age. So are you less than 2 years old? Are you more than 60?
Mm.
Do you have other chronic conditions like bad lung disease, COPD, emphysema, you know, some of those things, kind of heart failure, high blood pressure. Some of those underlying conditions do put people at a little bit more risk for getting serious illness if they get infected with the virus.
Right.
So the CDC.gov symptom checker is really, really helpful. It just came online a few days ago, and I tell you what, it's great, and it's very evidence-based.
Mhm.
Asks you all these questions. It's really fast, and then at the end, it'll tell you: are you low risk? Are you a medium risk? Or are you a high risk? The other thing that it does, it also asks kind of immediately,
Mhm.
are you dizzy or lightheaded? Are you really having shortness of breath?
Mm.
Because if you are, you need to call
Address it.
ahead to the ER
Right.
and not wait, you know. And the other big thing that we ask the community to do is to call your physician or call one of the hotlines
Mhm.
first. Don't just walk into the lab,
Right.
please. Please do not just walk into the lab.
For the safety of everyone there.
Right,
Right.
and the lab testing, the screening is actually not done in the lab.
Mhm.
It's done outside.
Right.
And that's to help keep everybody safe. And you know, at Queens, it's done in a tent outside, and
Right.
so all of these precautions have been set up, but they all need a physician order. And it's because, again, the test is very sensitive if you're having symptoms. You
Right.
need to have enough viruses
Right.
running around your nose to make that test reliable,
Right.
you know? And so that's why if you may be at risk, but you don't have symptoms yet, the recommendation is to actually self-isolate at home,
Right.
do your fever check twice a day,
Right.
and then keep in touch with your primary care provider.
That's really good.
Yeah.
So one more time, there's a CDC website where they can go to the symptom checker page, and I guess it would be readily visible if they go there.
It's right there. So you just,
Yeah.
when you go to the cdc.gov website, the first thing you're going to see is COVID-19 and that
Right.
famous picture of the red crowned virus. You just click on that page, and there's a search feature, and just type in symptom checker, and it'll take you straight to the page.
Okay. And is there a Hawaii website that you recommend people go to?
Yes, so the Hawaii COVID-19.com is the Department of Health website. It's the new website,
Okay.
and it's very user-friendly and pretty efficient in getting the information that you need.
That's great. Well, Dr. Lee Buenconsejo, we would like to talk more with you about ways that our community can help each other and keep themselves healthy at the same time, right after this commercial break.
Welcome back. If you're just joining us, we have Dr. Lee Buenconsejo, a family medicine specialist and also Associate Dean with the John A. Burns School of Medicine. In first half, she gave us a great introduction to her background and a little bit about this new virus that we're working with. I wanted to start off before we go into a second segment. We hear coronavirus, COVID-19, being used interchangeably. Can you tell us what is the proper way of describing this new virus?
Sure, good, thank you. So the regular coronavirus is really a common family of viruses that causes the common cold. So this is called it's a novel coronavirus or a new coronavirus. And it's new because it hasn't been seen in human populations before, and we don't have immunity to it, and that's why people can get sick and it can spread really rapidly. As opposed to the cold, we've all had colds, we don't get as sick from the cold. So the technical name of the virus is called SARS-CoV-2. That's how we have to order it on the lab tests. But really the new coronavirus or novel coronavirus is the virus.
Okay.
COVID is the disease, and it stands for coronavirus-induced disease. The number 19 is because it was discovered in 2019, and so that's the naming. So COVID-19 is because it's the disease. And so it's actually a big difference, but you're right, it's used interchangeably.
So when someone gets the coronavirus, they have the virus first, and I guess after they get tested and everything's confirmed, if they that's when they actually get diagnosed and it's the disease. Is that correct? Okay.
Correct.
Okay.
It would be COVID positive.
COVID
so this has to
positive.
be COVID positive.
Okay.
Yeah, and the virus has about a 4-day period where you don't have symptoms. So if you were infected, there is about 4 to 5 days where you don't show any symptoms, and then you start getting symptoms. Usually a fever, cough, the shortness of breath. It causes a pneumonia. This virus causes a pneumonia, which is a big lung infection. And so, but in about half of people, it actually takes about a week to develop. And so, and it lasts a little while, 14 to 19 days, which is why it's really, really important to prevent it. But it's also important to do the self-isolation for people returning from wherever they've traveled out of state. And it's because of that period before you develop symptoms, the asymptomatic period, that we're just not sure. Right? So.
Now, for the community that for them to do their part, we're asking them to stay home, don't go out if they don't need to, and if they're self-isolating because they may have some symptoms, what are some things that they can do to? I mean, there's no medicine out there right now. There's no vaccine. But what are some things that they may do to kind of help ease their, maybe even if they're having a fever? I mean, obviously, typically Tylenol, right? What are some other things that they can do? I mean, I've been hearing some people say, just stay hydrated, keep your throat moist, because that's where you can wash down the.
That's the one from Japan that was on Facebook.
Yeah,
right,
is that true?
Yes, no.
No,
okay. That's not true. Yeah,
Okay.
So it's a respiratory virus. It loves to get into and infect the cells in the lining of our mucous membranes, and our mucous membranes include our eyes and our nose, And so even if you do drink a lot of water, which is highly recommended, it's not going to address the
Prevent it.
viruses in your nose, right?
Mhm.
So really, if you get it, you got it. And it's a matter of just being very, managing your symptoms. And so fever is defined as greater than 100.4 temperature, so that's important to know. Now, in some patients, maybe a little bit more elderly, they may actually not get up to those high numbers, but they may say, I feel warmer than usual. And we know that as patients get older, sometimes they don't mount as good of a fever response. But that can be managed with Tylenol. And, the rest of it is just, good Kleenex and use only one at a time. And, you could, the typical thing when we think of, runny nose, I'm going to grab a Claritin or something. It doesn't work because this runny nose is from the virus, whereas Claritin and Zyrtec, or the generic versions of those, are really for allergy, which is a different mechanism. So there really isn't much you can do about the runny nose. If your nose ends up getting stuffy, certainly you could take some over-the-counter decongestant, things like that. But it's really what we call symptomatic relief. But the checking your fever, checking your temperature twice a day, and really paying attention. And if they start feeling short of breath, they really need to call their physician, because that's an indication that they're getting more ill. And it may not be from this coronavirus, but anytime you have shortness of breath, that's something serious, and we want to know about it.
So would you say that's the tipping point between just caring for yourself at home in isolation and going to the hospital?
Absolutely.
Is the shortness of breath?
Yeah.
Okay.
Absolutely.
Well, for a lot of our listeners who are Kupuna, they may also have a number of medications that they're already taking.
Yeah.
Right? How does this factor into managing their medication intake and helping their own health?
Yeah, good question. So, the good news is that Tylenol or the generic version is fine, acetaminophen. It doesn't interact with too many medicine. But, if they're not used to taking it, they actually might want to check with their doctor. If people do have pre-existing liver disease, then, we do put a limit on the amount of Tylenol, because high doses can, impact the liver. Similarly, a lot of people may take ibuprofen, which is Motrin or Advil, and that works great for fever. But if you have chronic kidney disease, you really shouldn't be taking too much of that whole class of medicine, which is the anti-inflammatory drug. And so we kind of would more stick with the Tylenol in the elderly, and less of the anti-inflammatories, because we just don't know what their baseline kidney function is.
Right.
So that's probably the biggest kind of medication or potential drug interaction that I would say. And the other thing is that if they have high blood pressure, they probably should not be taking a decongestant. So like Sudafed, which you have to turn in your license and get that from behind the counter. But even the over-the-counter decongestants, it can actually raise blood pressure, and so you really probably shouldn't do that. If your nose is really stuffy, you can use the nasal spray that with the saline, that works well. The neti pot, there's something where we actually irrigate. That's fantastic, and it's just saline, so no interaction with medicines at all. So the decongestants are really the biggest concern, because people might have high blood pressure.
So when they, I guess, during their isolation period, they tend to, obviously they're away from people. Keeping good hygiene is very important. When, I guess sometimes, their symptoms may go away, they may feel better. How long do you think they should continue to isolate until they're cleared?
Yeah, good question. So currently the recommendation is 7 days after your last symptom is really kind of the okay time. And that's what all of the hospitals and the CDC are using as the criteria to say that it's okay for someone to be out of isolation. So yeah, so 7 days after your last symptoms. So, I'm feeling, I was feeling lousy yesterday, and now I feel great, and I can go shopping. Yeah, no, stay at home. So still 7 days. But it's important, when people are at home, whether they're truly self-isolating or if they're just, at home, it's really important to stay connected. And so, pick up that phone. If you can text, learn how to use the text. If you don't know, have your grandkids show you how to do that. FaceTime and something. And the other important thing is please do not watch the news 24/7. Please,
Yes.
please. No matter what station or anything, it's,
Right.
there's so much going on in the world, and we do know that constant watching of the news will definitely induce a lot of worry, anxiety, sleeplessness, depression, and so, take your news maybe twice a day, seriously,
Right.
15 minutes.
Doses, right, at a time.
Yeah, and this is actually proven. So
Yeah.
it's, like 15 minutes
Right.
twice a day, and do something else.
Mhm.
Go garden. Just because you're at home doesn't mean you can't go outside your home.
Right.
So, the weather's getting better, go ahead, pull your weeds, or, whatever it is, stuff like that. Walk outside, in the sidewalk, again, as long as you're practicing social distancing, there's nothing that's preventing you from walking on your block,
Right.
or walking around your house just to
Right.
get out and get some physical activity.
It's really good to pay attention to not just, whether or not you have it or not, but to take care of your emotional well-being, because there are a lot of other things that could, degrade our health, right? Like stress and worry.
Yeah.
So that's really good advice. Well, Dr. Lee Buenconsejo, it's been so great having you on the show. I wish we had more time, to be quite honest, but hopefully that was a real good overview of the new coronavirus, things we can do to prevent it, things we can do to keep ourselves healthy, and also what we can do to help our frontline medical community in doing their jobs well. So thank you so much for being on our show.
Thank you for having me.
Coming up next, we have our KupunaWiki Classic Trivia.